Thank you all for joining us today. Today, we do have some good news. Today at Kern County Fairgrounds at 2 p.m. this Wednesday, we'll be opening up a new surge testing facility. This will help us get closer to mitigating COVID-19 throughout our community. As we know, we have a rise of COVID throughout the Central Valley. And the only way at first to get a handle of this is testing. We have some problems within testing that it's been taking some of the labs back 2 weeks to get the notices back. Working with the Trump administration and Health and Human Services, we're able to put forth a surge testing facility. Right now we're opening at the fairgrounds. It'll open at 2 today, and from then on it'll be from 7 a.m. to 7 p.m. It's free of charge. People can have a walk-up, but it's better if you make an appointment. It's a drive-through facility, and if you go to my Facebook page at Rep. Kevin McCarthy, you can have the application right there to get your appointment to be tested, free of charge. We want to know those who have it to be able to trace and get a handle on the rise of COVID throughout the Central Valley. They have used these facilities in New Orleans and Miami, and it's my belief that this is the first one in California that we're using. So I want to thank the Trump administration and Health and Human Service and our public health for working together to be able to bring this to the residents throughout Kern County. As we battle this, being able to be tested, being able to trace it, but get the results back quickly. And in these surge testing, they get them back 48 hours or less, which is very helpful. Gives us a better handle of the treatment and really to mitigate COVID throughout the Central Valley. I'm very thankful that we have some really special guests. I'm very honored to have our Assistant Secretary of HHS, Admiral Brett Jerwall. You see him on TV. He's working night and day. Talk to him often. And when I was discussing the rise in the Central Valley, he talked to me about putting a surge unit in here. It's something they've been able to do to combat the hot spots throughout America. And I can't thank him enough for how fast he was able to work and how quickly we were able to get this unit up and running. So if you want to have an appointment, just go to my Facebook page at Rep. Kevin McCarthy, sign up or walk in or drive through at the fairgrounds. Admiral, let me turn it over to you, and then we'll go to our public health as well.
Thank you so much, Leader McCarthy. And I really appreciated your communication and for us to gain a great understanding of what's going on in your district. And again, as you said, this is what we're calling a surge testing site. This is federally supported. We bring in the healthcare professionals, we bring in the web services, we bring in all the swabs, tubes, media, do the laboratory tests, and have a web reporting. And the goal is really to supplement your already excellent public health that you have going on there, because when we see a hotspot starting, we know that surging testing can be helpful. So we are planning to be there to do up to 60,000 tests. That's up to 5,000 per day. And we really are there to help you and your local public health. We have one site now. If it's determined that your local public health wants to split that into 2 or 3 or have alternative ways, we're all open to that. We want to support your testing priorities. For example, if your local public health, certainly if anyone's symptomatic or they've been exposed to someone, that's a reason to come in. But if your public health wants to focus on 18 to 25-year-olds or 35 to 40-year-olds who may have been at some event, we really are there to serve you and to help that surge. And again, just to remind everyone, testing is an important component, but the most important thing is avoid those indoor spaces, crowded spaces, because we know that can really spread. Do good hand hygiene, and very important for everyone to wear a mask in public. That's the way that we turn this around. If you look at Phoenix and Arizona, pretty close to you guys, they were at a 26, 28% positivity rate, and they're down into the low teens and just heading down. What we did there, limit indoor dining in bars, wear a mask, and have a surge testing site, and it turned right around. So again, to everyone there, thank you for your leadership, sir. Thank you for the communication. We're here to support your local public health. This has been a great collaboration, and anything I could do to help, please call me as you have before, and we will be on it. So thank you for the opportunity to serve all the good Californians out there to get this turned around.
Thank you, Admiral. Thank you for your service and your quick work on this. We also worked with our public health, Matt Constantine, who's done a tremendous job. And the one thing we have learned about COVID, it comes rapidly, it spreads rapidly. So that's why it's so important for this surge unit. It also alleviates a great deal of concern for the hospitals, for people going in there to be tested when we have to have treatment and others. So it alleviates our public health, but it also provides, we need to get the word out. If anybody wants to be tested, they can drive through. It's free of charge. You'll get the results back quickly, and we'll get throughout the Central Valley, get this COVID started to mitigate it. And that's what the surge unit is all about. And I want to thank Matt for his work. We've talked late into the night, working with the federal government as well, finding our best locations. And Matt, let me turn it over to you.
Well, Congressman, thank you. The ability for you to respond so quickly and to establish this site just so quickly out of nowhere is just fantastic. And it is so timely. We are very appreciative of your help. As you know, we've had some increased numbers. We've had some long lines waiting. We've had some extended turnaround times. And as you have said, that really inhibits some of our ability to identify those that have been affected early and to ask them to self-isolate so we can control this. With your ability to do 5,000 a day, to have quick turnarounds, to have it a drive-through, to have it free, you've taken away all the barriers. So I am optimistic this is really going to help us get a better control and to implement some local controls so that we can get a hold of this and get our businesses back open.
Matt, you're right. My number one concern is everyone's public health, just like yours. We want to make sure economically we stay afloat as well. And we've watched this come upon us as I've spoken with you in the hospitals. We'd have a few come in and get tested, but we'd go from a number of 100 to 400 to 800 to 1,800. We watched how rapidly this came upon us, but the quick action from the Admiral and the federal government, the Trump administration, just reaching out to them, talking to them what we're seeing, and showing the results of how successful this surge unit has been in other cities and hotspots. I want to make sure Bakersfield and all of Kern County gets treated correctly. And I can't thank the Admiral and you enough for working together, just talking last week as we saw that surge begin upon us. Now it's upon us as residents to be able to participate in this, to get a handle of where COVID is at, get it under control, and continue to practice those smart things that we need to do, the washing of the hands, the wearing of the mask. And we'll keep this economy moving at the same time, maintain our health. So I'm not sure which way we want to go from there. If you want to sign up, get an appointment, just go to my Facebook page at Rep. Kevin McCarthy. You'll be able to do that. But if you want to take some questions, because we've got the Admiral, you get Matt every day, so we could do the Admiral first for any questions.
Thank you. As a reminder, if you would like to ask a question, please chat the moderator directly. Our first question comes from Sam Morgan at the Bakersfield Californian. Sam, your line is open. Let's see.
Can you hear me now?
Yes.
Great. Yes. I have a question for Representative McCarthy. I was wondering when you realized that a surge testing facility might be needed here in Bakersfield and what you had to do in order to bring it here.
Well, I had been working, checking with Matt, talking with him on a regular basis, monitoring it, working with the hospitals, talking to the hospitals daily, and we'd see the incoming, but also what I found what was happening on the testing, the results, because the labs are being overwhelmed, were not coming back for 2 weeks. Well, that is not helpful in a time to manage COVID. And if you watch from any of this from the beginning, the doubling that you get is a real concerning. And I've watched that doubling hit. I put a call into the Admiral who very quickly responded back. I was down at the White House. I brought the attention to the president. He told me to call the Admiral. And the first thing the Admiral says, look, we've had these surge units. They can't put them everywhere, but what we found in hot spots that they were able to make a fundamental difference very quickly because they get the results back within 48 hours. They could put up multiple sites. It's free. Every barrier that you have to get a handle on, these take care of this. And it's something that the Admiral has designed and put forth in other parts of the country. So just the turnaround, we worked with Matt. I talked to the governor, making sure we can get the unit in, and we were. It's rather amazing. We're just talking within a week's time frame that we are now going to have people coming through as of today at 2 o'clock. From then on, from 7 a.m. to 7 p.m. When we get the bigger capacity there, we can go to other locations. So we're really kind of ahead of the curve. Unfortunately, we probably could have been faster had the labs got us the results quicker. But what happened with that 2-week backlog, we were a little behind the time because we didn't get the notification, and it all came at once. So you watch that doubling from, I watched those one days, Matt, from 400 to 800 to 1,000 to 1,800. But luckily we had this all in the work during that time, and having that constant communication was very helpful to have that data. And I'll tell you, when I called the Admiral, he had known about the Central Valley, and he was looking at it even before I called him. So that was very helpful.
Right. And let me just say that Ambassador Burks and her analytic team really provide us a list of places that a surge site might be helpful. And that's given the outbreak characteristics in your area, but also the ability to really squash it down. That if we do the right things, you can really turn it around rather quickly. So that it was just a perfect meeting of this was a candidate site that we were considering. The leader called and really explained the dynamics. And of course, you could bring a horse to water, but you can't make the horse drink. You got to have the local public health that just really embrace this, because it's not just us swooping in. We bring a lot, but the local public health and they need to bring security and logistics and the place and, you know, the hardscape that's around there and the public health leadership to help direct the citizens about what needs to be. So this really is a great collaboration. Again, we aim for 48 hours once it gets to the laboratory. So we've been about 3 days, which is still very good for the number of tests. But overall, on the national scale, LabCorp announced this week that their turnaround is going to be 2 to 3 days. So we're going to improve on that front too by all the technologies and FDA authorizations we're doing. So while we're doing this, we're hoping to get the other side of the equation in better shape too. But again, these surge sites have been really great. We have a contract organization called eTrue North that's been fantastic, that allows us to do this so quickly and hopefully effectively. Day one will be 80% there, and by day two, you'll be on 100% efficiency.
Yeah, and talking to Matt late at night, he was telling me the concern was getting the results back soon enough and what he was seeing coming, the wave. And that's how we were able to kind of get ahead of this, working with the Admiral and others. And it's been a great collaboration together. Think about it. You have a unit up in less than a week, going to provide this for the next 2 weeks, free of charge, lab work, staff, everything about it. I haven't seen this anyplace else, really, that being able to do something like this. It's really amazing, the collaboration together. So thank you.
Well, let me say also, leader, it's because of your leadership in funding our program that we're able to do this. I mean, you know, that starts from your leadership in providing the funds to us so we could get these services and really serve the communities that are in most need. So it starts with you. I'm just the intermediary to get it done. So thank you again.
Okay. Next question.
Those are currently the only questions that we have in the queue.
All right. Well, we want to thank you all. We want to make sure if you could do a favor to the community, get the message out. No one has to worry about getting out of their car. No one has to worry about a cost. They know they can get it back. They can drive through. They can sign up. It doesn't matter who you are. If you're in the community, you need a test, we have an opportunity for you to get through, because with public health, we want to make sure your health is top priority. And this is a way to get a handle on COVID. First and foremost, the testing. We'll be able to trace it. We'll keep our economy open, still practice the smart things that you should do, the washing of the hands, the safe distance, the wearing of the mask. But more important, there's a lot of people who do not have symptoms. If you've been around somebody, come through, get a test. There's no reason why you shouldn't be able to do it. Sign up. That's how walk-ins as well. It'll be from 7 a.m. to 7 p.m. But today it opens at 2. Matt, do you have any final words as a public health?
No, just thank you very much, Congressman. I think this is going to be a great endeavor, and I'm anxious for today. There's been a tremendous outpouring already from the public. So I think this is going to be a really needed resource, and I'm grateful that everybody's here and helping out. So thank you.
Well, thank you, Matt. Thank you, Admiral, for the work you're doing, and let's continue for everybody out there to stay safe. God bless.